Hello and welcome. Today we're diving into the world of pancreatic pseudocysts, a condition that can arise from inflammation or injury to the pancreas. We'll explore what they are, how they develop, and what can be done about them. So, let's get started. What causes these pseudocysts? The most common culprit is pancreatitis, both acute and chronic. Acute pancreatitis, often triggered by gallstones or excessive alcohol consumption, can lead to the formation of these fluid-filled sacs. Chronic pancreatitis, a long-term inflammation of the pancreas, also contributes significantly. Other less frequent causes include abdominal trauma, pancreatic tumors, and even certain rare genetic conditions. Essentially, anything that damages the pancreatic ducts can potentially lead to pseudocyst formation. Let's break down how a pancreatic pseudocyst actually forms. When the pancreas is injured, digestive enzymes that are normally released into the small intestine leak out into the surrounding tissues. These enzymes begin to digest the tissue, causing inflammation and fluid collection. The body then attempts to wall off this collection of fluid and debris, forming a capsule. Unlike true cysts, which have an epithelial lining, pseudocysts are lined by fibrous or granulation tissue, hence the name pseudo, meaning false. Pancreatic pseudocysts are relatively common, especially in individuals with a history of pancreatitis. The incidence varies depending on the population studied and the definition used. It's estimated that around 5 to 16% of individuals with acute pancreatitis will develop a pseudocyst. In chronic pancreatitis, the prevalence is even higher, ranging from 20 to 40%. Alcohol abuse and gallstone disease, major risk factors for pancreatitis, indirectly increase the risk of developing pancreatic pseudocysts. The symptoms of a pancreatic pseudocyst can vary greatly depending on its size and location. Some individuals may have no symptoms at all, while others experience significant discomfort. Common symptoms include persistent abdominal pain, often radiating to the back, nausea, vomiting, and a feeling of fullness after eating only a small amount of food. If the pseudocyst becomes very large, it can compress nearby organs, leading to jaundice, yellowing of the skin and eyes, or even block the flow of food through the stomach. In severe cases, complications like infection, bleeding, or rupture can occur, requiring immediate medical attention. Diagnosing a pancreatic pseudocyst usually involves a combination of imaging studies. Computed tomography, or CT scans, are commonly used to visualize the pancreas and identify the pseudocyst. Magnetic resonance imaging, or MRI, can provide even more detailed images and help differentiate a pseudocyst from other pancreatic lesions. Endoscopic ultrasound, or EUS, involves inserting a small ultrasound probe into the esophagus and stomach to obtain close-up images of the pancreas and surrounding structures. EUS can also be used to obtain a fluid sample for analysis, helping to rule out infection or malignancy. Blood tests, including amylase and lipase levels, may be elevated, indicating pancreatic inflammation. While there aren't strict classifications, pancreatic pseudocysts are often categorized based on their size, location, and whether or not they are causing symptoms. They can also be categorized as acute or chronic, depending on the underlying cause and the timeframe of their development. The treatment of pancreatic pseudocysts depends on several factors, including the size of the pseudocyst, whether it's causing symptoms, and the presence of any complications. Small, asymptomatic pseudocysts may be monitored conservatively, as many will resolve on their own. However, larger or symptomatic pseudocysts often require intervention. Drainage procedures are the most common treatment option. This can be done endoscopically, surgically, or percutaneously, guided by imaging. Endoscopic drainage involves creating a pathway from the pseudocyst into the stomach or duodenum. Surgical drainage typically involves creating an opening between the pseudocyst and the stomach or small intestine. Percutaneous drainage involves inserting a catheter through the skin into the pseudocyst to drain the fluid. Medication may be used to manage pain and prevent infection. Preventing pancreatic pseudocysts primarily involves preventing pancreatitis. This means avoiding excessive alcohol consumption, maintaining a healthy weight, and addressing any underlying conditions like gallstones. For individuals with chronic pancreatitis, adherence to prescribed medications and lifestyle modifications, such as a low diet and avoidance of alcohol, can help reduce the risk of pseudocyst formation. The prognosis for pancreatic pseudocysts is generally good, especially with appropriate treatment. Many small pseudocysts resolve spontaneously, while larger ones can be successfully managed with drainage procedures. However, complications such as infection, bleeding, or rupture can occur, potentially leading to serious illness. Research is ongoing to improve the diagnosis and treatment of pancreatic pseudocysts, with a focus on minimally invasive techniques and targeted therapies. Scientists are also exploring ways to prevent pancreatitis, which could ultimately reduce the incidence of pseudocyst formation. Thanks for watching.